So here we have a 35-year-old female who's presented with fatigability and drooping of eyelids, which worsens after exercise. The most important clue here is that it worsens after exercise, which gives away the diagnosis of myasthenia gravis. So this female would be positive for which HLA subtype? So HLA subtypes associations with disease is a very important topic. Frequently asked questions are there on this topic. So we would see the mnemonics to remember the HLA subtypes. So in HLA subtypes, we start with HLA-B. So we have HLA-B5, we have HLA-B8, and we have HLA-B27. So B5 is associated with Behçet's disease. How do we remember that? So Behçet's is B, E is alphabet number 5. So Behçet's is B5 or B51. So remember B51, B5 association. Then we have B8, which can be read as bet, that is B8. So I bet you that it would be a magic if you see somebody's graves which is in the ceiling. So grave in ceiling is a magic. So B8 mnemonic is magic. Whose grave is it? It is the grave of myasthenia gravis and his son's graves is in ceiling. So if we decode this mnemonic, so magic stands for myasthenia and his son is Addison, grave is Graves' disease, ceiling is celiac sprue. So myasthenia, Addison, grave and celiac are associated with B8. So B8 is a bet that it's a magic. Then we have B27, which is the most frequently and commonly asked. We all know it is associated with ankylosing spondylitis. The other conditions it is associated with is, we remember it by the mnemonic pair. So 27 is the age when you get married and become a couple or a pair. So that stands for psoriasis, ankylosing spondylitis, inflammatory bowel disease, and Reuters. So basically these are all spondyloarthropathies which are associated with HLA B27. So those are the HLA types B. Then we have HLA-DR. HLA-DR 2, 3, 4, 5 and 7. 6 is in a fix, so it is not there. So we have 2, 3, 4, 5, 7. So in HLA-DR 2, so it is journey of doctor to becoming MS. So journey of becoming doctor to MS, that is surgeon. So DR2 is associated with multiple sclerosis. HLA-DR3, so remember that 2, 3 is butter-free, 3, 4 is sugar-free. So butter-free is basically butterfly, the butterfly rash which is seen in SLE. So SLE is associated with DR23. Sugar-free means diabetes mellitus. Which type? Type 1, that is insulin dependent. So diabetes mellitus type 1 is 3, 4. Then we have DR5. So 5 is basically hum panch. So that stands for Hashimoto's and pernicious anemia. So 5 is associated with Hashimoto's and pernicious anemia. Then we have DR7. So 7 is associated with steroid responsive nephrotic syndrome. So 7 is steroid responsive nephrotic syndrome. Which HLA subtype is associated with rheumatoid arthritis? So rheumatoid arthritis, so a room has 4 walls, so it is associated with DR4. So rheumatoid arthritis is DR4. HLA subtype associated with celiac sprue or celiac disease. So in celiac disease, wheat is avoided. The HLA subtype associated is DQ28. To remember, we have wheat, DQ, that is in Hindi, wheat DQ to celiac patient. So wheat DQ to celiac patient. So DQ2 is celiac disease. So these are the important HLA subtypes and their associations. This is an exhaustive list, but at the same time important. If you revise it frequently, you will remember it very easily and in a better way. So coming back to our question. So this was myasthenia gravis. So we know that myasthenia gravis, that is the grave of myasthenia in ceiling, it was a magic, that was a bet, that is B8. So it is associated with B8. DR2 we saw, 2-3 is butter free, that is SLE. 3-4 is sugar free, that is diabetes. 27 is pear, those are the spondyloarthropathies.